Welcome to AI Explains.
Hello.
Sometimes the biggest breakthroughs in medicine aren't, these futuristic gene therapies or nanobots.
hmm
There's something incredibly mundane.
Right.
Today, we're unpacking a really pivotal moment in the COVID-19 pandemic.
Yeah.
It involves a drug that costs pennies,
Yeah, pennies. And it's available in basically every pharmacy on Earth.
and it likely saved, over 1 million lives globally?
It's really a case of repurposing a blunt instrument for a very delicate job. We're looking at the UK's recovery trial,
Okay.
which was this monumental effort to find treatments using existing drugs at lightning speed. And they struck gold.
But before we even name the drug, I think we have to set the stage a bit.
Yeah.
Because when COVID-19 gets really severe...
When people end up in the ICU.
Exactly. It's often not the virus itself doing the worst of the damage, is it?
Yeah.
It's the body's own reaction.
That is the critical distinction. In the early phase, sure, your immune system is hunting the virus, but in the severe cases, that response just goes haywire.
Cytokine storm,
We
right?
call it a cytokine storm, yeah. The immune system essentially just floods the lungs with inflammatory proteins.
It's like having a sprinkler system in your house.
Mm-hmm.
If a single candle is burning, the sprinkler shouldn't go off. But here, the whole system panics, floods the basement, ruins the drywall, just to put out this tiny flame.
That is a perfect analogy. The flood is literally fluid filling the lungs, making it impossible to breathe.
And that's what kills people.
That hyperinflammatory phase is what kills the sickest patients. And that brings us to the drug, dexamethasone.
Which is just a bog-standard corticosteroid. We've had this stuff on shelves since the early 60s.
It's practically ancient in medical terms, and we should be clear, this is not the kind of anabolic steroid athletes might use.
Right. Not for building muscles.
No, dexamethasone is purely a potent anti-inflammatory. It acts as a system-wide brake on that immune response.
So the researchers just asked a really simple question.
A simple, brilliant question.
If the immune system is overreacting, can we just use this old drug to tell it to? All to calm down.
And they tested this on a massive scale.
How many people?
Over 2,000 patients got the drug, and they were compared to more than 4,000 who just got standard care.
And for the really severe cases, the results were staggering.
They were. For patients already on ventilators, dexamethasone reduced deaths by 1/3.
1/3.
I want to pause on that number because in critical care medicine, a 33% reduction in mortality it's almost unheard of.
So that means for every 8 people on a ventilator who got this drug.
One life was saved. One person walked out of the hospital who statistically shouldn't have.
And it worked for the next group down, too, right?
Yeah.
The people who just needed oxygen.
It did. For them, it reduced deaths by 1/5.
Which is still huge.
It translates to saving one life for every 25 treated.
Yeah.
When you apply those numbers across the whole pandemic, the impact is just astronomical.
But, and this is a huge but, this is not some magic bullet you take the second you feel a cough.
No, absolutely not.
A trial showed that for patients with mild cases, the ones not needing any breathing support,
The drug did nothing. Or worse, the data actually suggested a trend toward harm in those mild cases.
which goes right back to the sprinkler analogy we were talking about.
It does. It fits perfectly. If you turn on the sprinklers when there's no fire, or just a tiny controlled flame.
You're just destroying your house for no reason.
Exactly. Early on, you want your immune system fighting the virus. If you hit the brakes with dexamethasone too early, you're basically shutting off the security system while the burglar is still in the house.
You need good guys to do their job first.
You let them do their job. You only bring in the steroid when the immune response starts attacking the body itself. Timing is everything.
Wow. It's such a powerful reminder of how complex this all is. But what a massive win for global health.
A huge win.
A treatment that doesn't need a freezer or specialized manufacturing.
It's cheap, it's stable, and it works. And it just highlights the value of these big, rigorous clinical trials. We wouldn't have known about that crucial timing without them.
It really makes you think, if a generic steroid from the 1960s was the key to surviving a brand new virus, how many other old cures are just sitting on pharmacy shelves right now, just waiting for us to discover what else they can do?
That is the question that keeps researchers up at night.